Think about what that means. Think about the opportunity cost of that. Think about how many thousands of Americans have died because we didn't know that. The federal government was in charge of getting us tests. Alex Azar and President Trump didn't get around to it. The day after this first now known case, this 57-year-old woman died in Santa Clara County, was the day that the Trump administration actually sent out testing kits to public health labs around the country. Those tests didn't work. They didn't even get them out till the first week of February, and they didn't work. And everybody had to start from scratch there because the Trump administration blew it. But think about how many lives would have been saved if there had been a fracking, reasonably competent federal response. Think about how many lives would have been saved if there had been testing at that point in the epidemic when there was community transmission happening in early January in the San Francisco Bay Area. I mean, other countries had tests at that point. We didn't. But imagine how many more lives could have been saved had somebody like Dr. Sarah Cody in Santa Clara County and her colleagues in the Bay Area who were so on top of this, had they known even weeks earlier that people were already dying, they would have acted weeks earlier. And yes, probably the rest of the country would have still followed behind them. Yes, they still probably would have been more aggressive and smarter than anybody else. But if our entire timeline had moved up several weeks, had moved up 3 weeks, thousands, if not tens of thousands fewer Americans would have died. Because everybody would have squashed the curve earlier. Everybody's curve would look like San Francisco's does compared to the rest of the country right now. Sarah Cody told the San Francisco Chronicle upon learning of this earlier case, she said, quote, "I know that in late January through the month of February, we were very anxious at our inability to test people who we thought might have had COVID-19. There just wasn't the capacity there. We were anxious that there was a lot of transmission that was going undetected. What these cases that have just been detected now tell us is that we were right to be anxious." They were looking for it. They were looking for signs to act. Once they got one, they acted faster than anybody. Had they known 3 weeks earlier, had they been able to test, they would have acted 3 weeks earlier. Early action in Northern California saved tons of American lives. And now with the epidemiological work they keep doing, we know that the earliest cases we had in this country were even earlier than we previously knew. Had there been tests, had that been the one thing the Trump administration did, even with the labradoodle guy in charge and firing the vaccine guy and being scared of the lady at the CDC who tells too much of the truth, had they just gotten testing done, had Alex Azar and the Trump administration not been lying when they said testing was fine, we could have acted weeks earlier. At least in the best run parts of the country, they would have acted weeks earlier. And there wouldn't be going on 50,000 Americans dead by the end of this week.